Hello and welcome to the Nurse Station. I'm Maria Mobley and today we're going to talk about vital signs. So I want to put a humongous disclaimer on this video. This video is targeted to those brand new nursing students in fundamentals learning about vital signs. And I really want to help, if I can, talk about critical thinking with vital signs. And something you need to really understand. There will never be that perfect number of a vital sign that we know exactly how to act every time. It doesn't work like that, not even the NCLEX perfect world. So the vital signs of a client depend on so many things. Age, their health history. For instance, a patient with COPD, chronic obstructive pulmonary disorder, we may be okay with their O2 sats ranging in the 88% to 92% range. That could be okay for them, dependent on the physician order, due to their health history. So please remember, it's not like every single time when this vital sign occurs, we're gonna act like this. This is just to help you critically think, because I have, again, taught nursing students for years, and I notice if vital signs are slightly abnormal, nursing students may prioritize it just because it's not the perfect number that we want. But let's talk about when I would be concerned about vital signs as a nurse that's been practicing for 13 to 14 years, just to help you start to critically think on these NCLEX style test questions. So a couple things to remember. This is critical thinking for adult vital signs, and this is specifically for your adult medical surgical patient. I'm not talking about somebody that is critically ill or in a psychiatric crisis. I'm more gearing it towards your adult medical surgical clients, okay? So first off, when you're looking at the stem of your questions, always note health history, because that could kind of give you some information about what vital signs are trying to show you. Is the client symptomatic? That's another very important thing. I'll give you an example. We know normal heart rate is 60 to 100. But we can let somebody have a heart rate of 50 and do nothing if there are no other symptoms. They may not warrant intervention. So always look for, are they symptomatic? If they have a heart rate of 50 and they are unconscious, we are highly concerned, right? So look for other abnormal symptoms. And then if you do prioritize a vital sign, so if you're looking at a test question and it says, what vital sign is priority to report? Or you have 4 patients and it's giving you different vital signs for each patient, and it says, who would you go to first? If you pick that vital sign, I need you to think, if I can prioritize this as my most concerning vital sign, I should also be able to state what I could do about it. Because I've noticed sometimes my students pick vital signs that they say are concerning, but when I ask them, how do you act? What is your nursing action? They have none, because that vital sign isn't critical enough to do something about, okay? I'll give you an example on that. Respiratory rate. We know normal respiratory rate is 12 to 20 breaths per minute. I had a test question where students pick the most concerning vital sign is a respiratory rate of 26. Well, I asked them, what would you do about a respiratory rate of 26? Think, when somebody has an elevated respiratory rate, aka tachypnea, there's things. Think about somebody in a panic attack, for instance. We could give them anxiolytics to sedate and calm them down. You always remember people putting a brown paper bag to breathe in, right? So they don't lose so much carbon dioxide. We have a mask in healthcare that could mimic that brown paper bag. But with a respiratory rate of 26, we're not doing those things. It's not high enough. It doesn't warrant action. So think about, if I, as a student, am going to prioritize a vital sign in this NCLEX style question, how am I going to act on that vital sign? Meaning, how I'm going to treat this patient to improve their condition in that moment, okay? So I've listed vital signs here. As you can see, I've left off pain. Please watch my Maslow's video. In my personal opinion, and how I prioritize clients, I never choose pain over physiological problems unless pain is life-threatening, such as chest pain. Okay, so yes, pain is a vital sign. Yes, we treat pain and we listen to patients with their complaints of pain. But again, in my Maslow's prioritization, I do not prioritize pain over physical health, physical well-being. So I'm not going to talk about that in this lecture. Now, let's start with oxygen saturation. Ideally, and we want adult clients to be 95% to 100%. That means, hey, they are oxygenated, their blood is perfusing the cells, the tissues, they have enough oxygen in their body. Well, I don't want you to think about it as a golden rule, but if you see a O2 sat less than 90% in the NCLEX perfect world, we should be administering oxygen. My students say, oh, Miss Mobley, what if they have COPD? If it is not in that question, if you do not see it on that paper, please don't say what if. That is an assumption, that is a guess. If you did that, you would do that with every NCLEX style question. So if it's not in the stem of the question, don't say what if. So if you see somebody's O2 sat is less than 90%, give them oxygen. That is safe. That is what is safe to do, okay? Their body is warranting the need for oxygen. Now, my students sometimes prioritize an O2 sat of 92% on room air as an example. I put a question mark because I want you to tell me what you would do, for instance, with an O2 sat of 92% on room air. There actually are things you could do. You could elevate that patient's head of the bed. You could tell them to deep breathe. You could tell them to cough. There are interventions we can do. But this is when the critical thinking comes in. With an O2 sat of 92% on room air, they should still be perfusing oxygen to their organs and their tissues. So would that be prioritized, for instance, of a temperature greater than 105, which is potentially life-threatening, or a respiratory rate of 7, or a heart rate of 160? So yes, we can still act with an oxygen saturation in this range, okay? Again, elevate the head of the bed, cough, deep breathe, but really think, is this gonna be prioritized over other abnormal vital signs that we might see in those questions, okay? Now, respiratory rate. This is one of the hardest things to talk about. Respiratory rate is never a clear, oh, they have a respiratory rate of 40, so we got to do this every single time. No. I really want to talk about something that you should always consider with respiratory rates, okay? So remember, normal respiratory rate, 12 to 20 breaths per minute, okay? Now, I put, you should always be looking in the questions if you see less than 10 breaths per minute. And a big thing to look for, think about what we give constantly in healthcare. One of the number one reasons to seek healthcare is pain, right? So think about how much pain medication we administer as nurses. We're taking care of post-surgical clients. We're taking care of clients with chronic pain conditions. We administer narcotics. We administer medications that can cause respiratory depression. So if you see a respiratory rate less than 10, you either better be gathering more data or looking for other concerning symptoms. For instance, are they a post-surgical client that's on a morphine PCA and now they're in respiratory depression? Hey, if they have a lower respiratory rate, can you arouse them, right? If you have a lower respiratory rate, what is their oxygen saturation? So I really want you to consider, with low respiratory rates, do we have to act? Do we need to administer oxygen if it's showing a low O2 sat? Do we need to provide ventilation? Do we need to potentially reverse them if they are on pain medication? Could it be the potential that we have to give naloxone, aka Narcan? So really, in these NCLEX style questions, if you have a low respiratory rate, you need to start thinking, are they in respiratory distress? Are they in trouble? I did not put a number to be on the lookout for when it comes to elevated respiratory rates. So just remember your medical terminology. When we say Brady, that means slow. So bradypnea means slow respiratory rate. When we say tachy, that means rapid or fast. So when we're getting above 20, tachypnea means elevated respiratory rate. So in terms of the elevated end of respiratory rate in actions, you really, if you're given an elevated respiratory rate, you need to look for other symptoms. Hey, are they having a panic attack? What is their oxygen saturation? What is going on? So that can give you more evidence as if you need to act immediately in that situation, or if it's the priority vital sign to pick. So again, remember there are interventions we can do for elevated respiratory rates. Again, I gave the example of panic attacks. We can give anxiolytics, we can give sedatives, we can put a non-rebreather, we can put a mask on them to try to trap all that excess carbon dioxide that's being blown off. We can give them oxygen, a lot of deep breathing exercises, calming techniques. So there are things we can do for elevated respiratory rate as well. I wish I could give you an exact number that says, hey, this is priority, we gotta act, but that's not how it works. So look for all those other concerning assessment data that would be along with tachypnea, okay? Now, heart rate. Normal heart rate is 60 to 100 beats per minute. Now, let me talk about, and remember, Brady means low, so let's talk about when your heart rate is less than 60. That's bradycardia. I actually want y'all to pay attention right when it hits 59. Because there is an action we can take as a nurse. We're not going to give drugs to increase that heart rate. It's not low enough yet. There's a drug that we use called atropine to increase heart rate. It's not meeting that criteria. But remember, we as nurses give a lot of drugs that can drop heart rate. Think about a big class of drugs that we have to count an apical pulse for a full minute. And if it's less than 60, don't we hold that medication? So if you ever see a heart rate less than 60, even if it's 59, look in the stem of the question and make sure that there's no action you need to do as a nurse. For instance, hold a beta blocker. Isn't that a drug class that we would hold for heart rates less than 60? What about calcium channel blockers? Wouldn't we hold that medication for apical pulse less than 60 beats per minute? Now, in terms of actually giving a medication to increase heart rate, so there is a certification you can get, it's called Acls, in which you are taught ways to intervene in life-threatening situations. And for instance, we have an algorithm for bradycardia we can follow. But I want to encourage you and just remind you, even when heart rates get less than 50, they're really looking for other symptoms. Are they symptomatic? Do they have a irregular heart rhythm? Are they unconscious, right? Are they showing a change in mental status? So even when it gets into the 50s, we still might not warrant medication intervention. So just keep that in consideration. Now let's talk about elevated heart rate. A lot of our standing orders in the hospital or healthcare setting that a doctor could provide is administer this PRN medication if the heart rate is greater than 120. Right? We could give, for instance, a beta blocker. We just talked about how beta blockers decrease heart rate. We can give a beta blocker to decrease that heart rate as needed with a heart rate greater than 120. But again, it's so dependent on the patient and their medical background, their health history. Do they have cardiac history? Do they have hypertension? All these things. So I just want you to keep in mind, would we really do anything for a heart rate 100 to 120 for an adult medical surgical patient? Not majority of the time unless they have other things to consider. But when we start seeing it getting above 120, we might consider the indication of medications to decrease that heart rate and other interventions that we can do. Now, when you think about heart rate, you should always be thinking about blood pressure as well. When I look at heart rate, the next thing I'm looking at is blood pressure and seeing if there's any correlations with the two. Okay, so I kind of grouped it, right? You got your breathing here, you got your circulation right here. Because at the end of the day, if you have multiple abnormal vital signs, you go according to Maslow's. If you have an elevated heart rate versus a low O2 sat, in my Maslow's mind, I'm going to that low O2 sat, right? Because that's breathing. So let's think about blood pressure. According to the American Heart Association, normal blood pressure is a systolic less than 120 millimeters of mercury and a diastolic less than 80 millimeters of mercury. So let's think about when I would be concerned. And again, this is just to help you critically think. I am not a physician. I don't prescribe. This is just try to help you wrap your mind around those test questions and know which one is more concerning to go to. So let's look at this. I put a little thing. When your systolic or any individual systolic blood pressure is starting to get less than 90 millimeters of mercury, you should start thinking about a lot of things. How's their mental status? Are they dizzy? Are they faint? Are they weak? Did this occur with a change in positioning, like orthostatic hypotension? Are they dehydrated? Are they showing circulatory depletion? A lot of things you need to think about. But again, my blood pressure is always usually 90s over 60s. That's where I run. That's my baseline, and I don't have any other symptoms. So yes, start looking into this, but also look at other things like heart rate and their mental condition and status and how they're feeling and their cognition. Are they completely oriented? Are they dizzy? Are they fatigued? So start considering looking at that. Now, in terms of the high end, please let me emphasize, we do not want people's blood pressure to be over 160 systolically or over 100 diastolically. We would want to really have a goal blood pressure much lower than this. But remember, this is prioritization of vital signs. I'm going to pick this as the most concerning vital sign. So in terms of elevated blood pressures, I'm starting to get really concerned when it's going above 160 millimeters of mercury and 100 millimeters of mercury diastolically. This is when you might, again, in the healthcare setting, have those PRN as needed medications to decrease blood pressure when you start to see clients elevate. And mind you, people, it's also very, very concerning if they have no hypertension diagnosis and they have these extremely elevated blood pressures. So that's when that health history comes into play. So yes, we want people to be maintained, their goal blood pressure to be much lower than these numbers. But I'm just trying to tell you when I would start prioritizing it as something to go to, okay? So again, another big thing, let's talk about looking at heart rate and blood pressure together. So let's say I have a lower blood pressure. Let's say I have a blood pressure of 84 over, let's say 56 millimeters of mercury, right? That's low. I'm concerned. But something that would be even more concerning, that would kind of really make me think about prioritizing this as something I need to go to and help and seek as a nurse, is if my heart rate is elevated. Let's say it's this blood pressure along with an elevated heart rate. Let's think about this. This is showing fluid volume deficit, right? We have a low blood pressure. Not only is it showing that there's a depletion of volume in the client's body, the heart is now trying to cope and pump faster. The heart is saying, oh goodness, I need to help. I need to get more oxygenated blood flowing and circulating through this body because I have a depletion. I have a volume depletion problem. So it starts pumping quicker and quicker. So when you are starting to see that heart rate and blood pressure are trying to show you something, you might need to go to this client. It might warrant fluid administration. It might warrant vasopressors, medications that constrict blood vessels to increase pressure. So always look at blood pressure and heart rate together. See if it's trying to show you something. But again, even with this value, if I had an O2 sat of 79%, again, in my nursing, Maslow's critical thinking mind, and again, this is just from being a nurse, from gaining that knowledge and that practice, according to my Maslow's and how I would act, I would still pick this patient in that NCLEX style question, okay? But again, still very concerning. I would look at it if there was no other vital signs that were more concerning than those, all right? Now, let's talk about temperature. Your normal oral temperature is 98.6 degrees Fahrenheit. So we have concerning things when it comes to hypothermia. So if you start to see a temperature of less than 95 degrees Fahrenheit, we have very different categories of hypothermia, right? Mild, moderate, severe. But you might need to think about, we might need to start intervening and warming this client, even if it's just putting warm blankets on them. But, you know, we can get to a severe hypothermia where we are infusing warm fluids and doing a lot more than that to warm their core body temperature. Now let's talk about the top. We know fevers are good for patients to a certain extent, but I see a lot of protocols that start actually telling the nurse to intervene. So a doctor could state, administer acetaminophen, which is AKA Tylenol, for a temperature greater than 102.2 or for a temperature greater than 102.5. So yes, we do like fevers, but we don't want them to get too high. So start thinking that you might be able to administer Tylenol once that temperature starts getting above 102 degrees Fahrenheit. If we get above 105 degrees Fahrenheit, that is a life-threatening emergency. They are too hot. So yes, we can even prioritize temperature, because especially if they have a temperature of 106 degrees Fahrenheit, that is life-threatening. So we would need to think about prioritizing that in the NCLEX style question. So again, this was just to help you potentially critically think. And again, always remember, at the end of the day, you pick the vital sign that is most concerning according to Maslow's. And also, please remember, if you pick it as your priority vital sign, I always want to think about how could you act? Because if there's no nursing action you can do, if there's no nursing intervention you can do for that vital sign, it's probably not your priority. So I hope this helps. And another little tidbit, if you do not have your normal vital signs memorized, there's no way you can start critically thinking about them in terms of what should I go to first and how could I even act with the vital signs presented on my test. So as always, we are better together. If this helped you, please help another student. Take care.